This video has been created for you by the physiotherapists of the Nottingham Shoulder and Elbow Unit. It will provide you with the information you need to prepare for your surgery. On the day of your operation, you will be admitted to either Theatre's Admissions Lounge or Surgical Short Stay Unit, both of which you will find along North Corridor. You will be given more information on this prior to your surgery. You should expect to stay in hospital for at least 2 nights. Whilst in hospital, you will spend your time on one of our orthopaedic wards, either Edward 2, Harvey 1 or Surgical Short Stay Unit. In this short video we will cover the anatomy of the shoulder, the type of surgery you might have, what to expect immediately after your operation, advice to help you manage when you get home, and where to find further information. Anatomy. This is what the inside of your shoulder joint looks like. It is a ball and socket joint formed between your arm bone and your shoulder blade. If you develop osteoarthritis in your shoulder, it can be painful to move your arm, making everyday tasks difficult to complete. It can also disturb your sleep. The blue shading on the picture represents your articular cartilage. As we get older, the articular cartilage wears away. This is otherwise known as osteoarthritis. It is the most common reason for needing a shoulder joint replacement. The main group of muscles around your shoulder is called your rotator cuff. This is a group of 4 muscles that attach from your shoulder blade to your arm bone. The rotator cuff works with the larger muscles around the shoulder to help you move your arm. Sometimes these muscles may tear due to degeneration or due to trauma. This may make it harder for you to move your arm. If you have significant levels of pain due to arthritis, your consultant may decide that a shoulder replacement is the best treatment option for you. The type of shoulder replacement you might have. There are 3 types of joint replacement you could have: hemiarthroplasty, an anatomical total shoulder replacement, reverse total shoulder replacement. In a hemiarthroplasty, this means that you either have the cup or more commonly the ball component of your shoulder joint replaced, but not both. In an anatomical total shoulder replacement, both parts of the shoulder joint are replaced using a prosthetic joint. In a reverse total shoulder replacement, both parts of the shoulder are replaced, but the ball and socket components are reversed. Your surgeon might decide to perform this procedure if you have an irreparable cuff tear. This will favour the other muscles around your shoulder to help you move your arm following your surgery. In order to perform your shoulder replacement operation, your surgeon will make an incision across the front of your shoulder as shown in the picture. Your surgeon will either use stitches or staples to close your wound after the operation. Typically, these are taken out 10 to 12 days following your surgery at your own GP practice. Your nurse will discuss this with you further before you leave the ward. In order to have your operation, the anaesthetist will give you a nerve block. This will mean that you will be unable to feel your arm during and for a short while after surgery. This may last up to 48 hours. You will also be sedated so that you will be asleep during your surgery. What to expect immediately after your operation. Regardless of what type of replacement you have had, when you return to the ward after your surgery, your arm will be in a collar and cuff and you will have a dressing on your shoulder as shown in the picture. After your operation, you will be fitted with a more supportive sling. This is called a polysling. You will be taught how to put on and take off your sling whilst you're in hospital. Further instructions for this can be found in your patient information booklet or via the video tutorial on our website. There are some things that you are not allowed to do following your surgery. For the first 6 weeks, you will not be able to lift anything heavier than a cup of tea, and you should not weight bear through your arm. For example, you should not push yourself up out of a chair using the affected arm. These restrictions are regardless of which replacement you have had. If you feel that you will struggle with certain activities post-operatively, such as getting in and out of a chair or on and off the bed, because you need your affected arm to do so, please let us know. We might be able to put measures in place to make things easier for you following your surgery. For those of you who have had a reverse total shoulder replacement, you should not take your hand behind your back until your outpatient physiotherapist advises you that it is safe to do so. This is to ensure that the muscles around your shoulder are strong enough to support your new shoulder in this position. You will come back from theatre with an acuffuser in your shoulder. This is a pump which will provide pain relief. It is usually taken down 24 to 72 hours after your surgery. Following your operation, a physiotherapist will come and see you on the ward. They will teach you the exercises that you will be expected to do, show you some comfortable sleeping positions, and teach you how to wash and dress. You will usually stay in hospital for 2 to 3 nights following your operation. As long as there have been no medical complications, you will be able to go home once your pain is controlled and you can complete all your exercises independently. You must also be able to manage to put your sling on and off by yourself. Support and further rehabilitation. You will be required to attend follow-up physiotherapy to help you make the most of the surgery you have just had. You can have this physiotherapy at a range of locations, and this will be discussed with you when you're in hospital. You will also be required to attend a follow-up clinic appointment which is run by the consultants and our specialist physiotherapists. You will have around 4 appointments depending on your surgery that you have had. These will roughly be at 6 to 8 weeks, 3 months, 6 months, and 1 year post-operatively. Driving. You can usually start driving when you have come out of your sling and have had your first clinic appointment. You need to feel confident that you can control the car in an emergency situation. It is good practice to speak with your insurance company to check that you are covered to drive following your operation. It is important to remember that this is just a guideline only, and you should discuss this further with a healthcare professional. Further advice and information. Should you require further information, you can call the City Hospital number shown on screen. Listen to the recorded message and dial the extension number you require from the table on your screen. Alternatively, you can visit our website. Thank you for listening. We hope you have found this information useful, and we look forward to seeing you soon.